My name is Alexandra Watson. I'm currently enrolled in Veterinary Pathology 1, and I'll be performing a serologic test and a chemistry profile. I'm going to be drawing blood for a heartworm test and a chemistry profile. We're going to take our sample and put it in a green top tube for the chemistry profile. We're going to be running a heartworm test, a test for the antigens of adult female heartworms. You're going to take your test, and you put your sample directly in the well. Then you're going to have 2 drops of buffer. If your test is negative, there will just be a line under the control, and if it's positive, there will be an additional line under the test. The heartworm test has been sitting for 10 minutes now, and as you can see, it's negative because there's just one line. I'm going to be running a Chem 10 profile today, which includes albumin, which can show signs of dehydration, hemorrhaging, and liver disease, globulins, which can show signs of inflammation, neoplasia, and hydration status, and the total protein, which is the total of the albumin and globulins, can show hydration status. And it also includes BUN and creatinine, which can show renal disease, and glucose, which can show diabetes and hypoglycemia. And it shows ALT, which can show liver disease, and ALP, which shows liver disease and increased steroids throughout the body, and can be increased from bone growth in young animals. We're going to take our sample and centrifuge it for 5 minutes. To analyze our sample, you're going to hit Analyze Sample on the IDEXX Vet Lab station. We're going to type in our patient's name. And she has previously had blood work, so we're going to click her name since she's already in the system. We're going to hit Next. We're going to choose our doctor. Then we're going to hit the Catalyst machine where the chemistry profiles are ran. And we're going to hit Run. We're going to select our patient's name, hit Select, and we're going to choose Plasma because we use the green top. We're going to hit Next. And then we're going to get our sample out the centrifuge. As you can see, it's centrifuged. We're going to open it. And we're going to take our transfer pipette and get our sample and put it into the sample cup. You're going to take your sample and put it inside of the Catalyst machine. And then we're going to be running the Chem 10. You're going to undo the clip and slide it right in there. And we're going to hit Run. The chemistry profile results are completed. And as you can see, the albumin is in the normal levels, which indicates that she is not dealing with any liver disease or hemorrhage. And the alk phos and ALT are in normal level, which indicates she's not dealing with any liver disease or Cushing's or any steroid increase in her body. And her BUN and creatinine are in normal levels, which indicates she's not dealing with any renal disease. And her globulins are in normal level, which indicates she's not dealing with any inflammation or neoplasia. And her glucose is normal, which means she's not dealing with diabetes. And her total protein is normal, which means she's euhydrated.